Setting: Community Health Center. You see a 66-year-old patient who is concerned about the varicose vein on his or her left leg, which have increasingly itchy. He or she would like some advice. You have just examined his or her leg. Now let's see the task. First one says, confirm inflammation of varicose vein, find out relevant patient details, general health, underlying health conditions. Second one says, find out more details about symptoms, onset, intensity of itching, any swelling or feeling of heat. Third one says, explain venous dermatitis is the reason for itchiness, chronic inflammatory skin disease, blood buildup in damaged vessels, eventually leakage, oozing or blood into the skin. Find out about any remedies tried, medicated creams or moisturizing lotions. Fourth one says, make recommendations to ease itchiness. Moisturize at least twice a day, take emollient without fragrance or dye, compression stocking. Last one says, emphasize importance of not scratching. Example, worsens itch, leads to cut, infections, etc. Advise need for doctor's appointment if symptoms get worse. Remind patient of varicose vein management and self-care. Keep active, use loose clothing, avoid standing or sitting long periods, elevate legs when sitting.
Now let's get into the role play. Thank you, Madonna, for allowing me to examine your leg. Based on my assessment, I can confirm an inflammation of varicose vein, but don't be overly concerned. This can be effectively manageable, and we are here to help you. Before getting into a solution, let me ask you a few questions regarding your condition. May I?
Sure, nurse. Please proceed.
Can you please tell me about your general health condition?
Nurse, I'm healthy as far as I know. I do not have any other medical conditions apart from this.
How long have you been experiencing this condition?
Nurse, I've been experiencing this problem for the last 1 year. However, I could see that my veins become much itchier nowadays.
Okay, Madonna. Can you please let me know how severe it is?
Nurse, initially, almost few months ago, it was not so severe. However, it became unbearable for the last couple of months.
Alright. Have you ever noticed any issues like swelling, itching, feeling of heat, or any other problems on your leg?
Yes, nurse, I noticed some problems when I scratch my skin. That is, it becomes red, swollen, along with pain, burning sensation. I could also see some changes in the skin color around the varicose vein.
Thank you, Madonna, for sharing all those details with me. It helped me to understand your condition much better. First of all, let me explain you what is varicose veins, its causes, symptoms and management. So, you can ask me if you have any questions at the end. Is it okay with you?
Please, nurse.
Varicose veins are swollen and enlarged veins which usually appears blue or dark purple in color. This usually occur on the lower part of your body, especially legs. Varicose veins itch because of a condition called venous dermatitis. It is a chronic inflammatory skin disease. It happens when blood accumulates in damaged vessels. It eventually leaks out into the skin. Then the skin of the vein becomes red and itchy. Now let's see what are the symptoms of varicose vein. There are various symptoms for varicose vein such as burning sensation in the legs, uncomfortable legs that feel heavy or achy, muscle cramps that can be more noticeable at night, swelling of the feet and ankles, and dry or itchy skin that appears thinner over the varicose vein. Apart from that, occasionally veins very close to the skin may burst. This usually causes only minor bleeding. Therefore, it requires immediate medical attention. But do not worry, Madonna. We have better remedial measures to manage this condition. Are you following me?
Yes, nurse.
Okay. Have you tried any medications
to manage
your symptoms before?
Yes, nurse. I usually apply a cream once in a day.
Okay, Madonna. I'm happy to know that. But I would recommend you to apply these medicated creams or moisturizing lotions twice in a day, which helps to reduce your itching and it brings down inflammation of your legs. Moreover, it can help moisturize the skin while it heals. In addition to that, you can use compression stockings. Wearing compression stockings or socks places pressure on the veins in the lower legs. This pressure can help improving the blood circulation and prevent further varicose veins. Compression stockings may also help to reduce swelling and lower the risk of blood clots in the legs. Apart from that, it helps in reducing pain related to varicose vein. Do you have any questions for me?
Yes, nurse. I feel like scratching the veins and I cannot really stop scratching it sometimes. When I scratch the vein, it leads to cuts, infections, and injuries. I don't know what to do.
I acknowledge your worries, Madonna, but it is highly important to avoid scratching the veins as it leads to worsening of itching and it may lead to cuts or infection. Instead of that, it is a good idea to make an appointment with your doctor when the symptoms get worse. I hope you're following me.
Yes, nurse, I understand that.
Apart from that, I can also suggest you some varicose vein management and self-care remedies which can be done at home. May I proceed, Madonna?
Sure, nurse. Please proceed.
First of all, you can keep yourself active. That is, you can do some simple exercises regularly which improves better blood circulation in the legs and make sure that you are not wearing tight clothes. This can restrict blood flow. You can wear loose clothes instead. It will help to improve blood circulation and reduces the pressure in the leg veins. In addition to that, you can also keep the leg elevated, ideally at the same height as the hurt or a row. So it will help to improve the blood circulation and this reduces the pressure in varicose vein. And never stand or sit anyway for a long period of time because it can cause inflammation of your veins. Finally, make sure to elevate your leg when sitting. I hope it's clear for you, Madonna.
Yes, nurse. I understand that.
I can also give you a leaflet which contains details regarding the management of varicose vein. You can go through it for a better idea. Do you have any more questions or concerns for me?
No, nurse. Thank you.
Okay, Madonna, I would like to summarize what we have discussed until now. So far, we have discussed about the varicose veins, its causes, symptoms and further management. I hope you understand that. If you have any more concerns, please feel free to contact me. I will be glad to assist you. Once again, I assure you that if you follow these instructions along with the medications, definitely you will get a better improvement and you can get back to your normal life as early as possible. Thank you, Madonna, for your valuable time. I wish you a speedy recovery.
Thank you, nurse. Thank you so much.
Thank you, guys. Our role play ends here.